Hello, my name is Gordon Henry, and I will be presenting my individual case final for the ISM 5014 Enterprise Information Systems class for the fall 2013 program at Nova Southeastern University. My individual case final will be based on an article I read entitled UnitedHealthcare Medicare Advantage to Cut Doctors. These cuts are because of the healthcare reform coming down the pike of 2014, which will leave some senior citizens without their doctors or physicians that they're used to seeing. To give you a brief synopsis about the UnitedHealthcare Medicare Advantage, is for senior citizens ages 65 and over. They have over 3 million senior citizens that can call themselves members, and with that number, they're one of the largest senior citizen healthcare groups in the U.S. Why are the cuts being made? Well, for one, they're trying to alleviate the $156 billion that the members of all insurance companies are going to save with the healthcare reform coming down the pike in 2014. Raising premiums as overall industry's premiums rise is one thing, and also the raising cost of quality care always seems to rise with the premiums. What's the real problem though? Well, UnitedHealthcare had poor foresight by senior executives. IT wasn't properly used to shift to this new infrastructure with healthcare reform, and money, basically because they didn't want to make cutbacks internal, they wanted to start external. The changes in IT, well, for one, what does the CIO have to say about this? He should have spearheaded the whole new infrastructure with the company's IT. The exact usage of the plan. What exactly are the senior citizens using in the plan that they can keep versus things that they can cut back on? And again, internal versus external. Are they willing to make the same changes inside of the company versus outside? Possible solutions would be an IT business strategy that's based over a 10-year plan to help alleviate some of the healthcare reform costs they're going to be taking in, and also cut backs on some of the benefits and not the policy. What exactly are the senior citizens using in the plan that's going to be effective, and what are some of the things in those plans they can cut back on without cutting the whole policy? Alternative cutbacks, using generic brands instead of prescriptions. Benefits and present day packages, what are those? We can definitely leave those in there. First of all, flexible and simplistic IT cutbacks as well. What are some of the things that we can cut back on that will help us work smarter and save more money without cutting plans, period? Results and conclusions, basically with slight more cost, the exact needs will be met of all the senior citizens. With the less cutbacks they'll make, they'll be able to save more lives. A lot of these senior citizens look at their doctors and physicians as their lifeline. Final thoughts. With the IT process, we can build smarter products. With these traditional models being a thing of the past, and with the new IT models of today, we can reach healthcare systems and policies to a much more broader and more individual need of all clients. Thank you.
Created using Powtoon.